Now, radiation today is much different than it was 10 or 15 years ago. Radiation today is incredibly precise, and everything is based on scans, and in our case, it's a CT scan. So what we do is we take you, and we have a CT scanner in our department, and we scan you in the position you'll be in every day during treatment. Now, it's important to understand that that CT scan is only for radiation planning purposes. We take that scan, and me and my radiation team plan the radiation on that scan. So it takes me and my team about a week or so. I draw the targets, and then I have a team of physicists and dosimetrists to do all of the calculations to arrange beams so that the ultimate plan gives me enough radiation to your cancer to cure it while still sparing your normal tissues. Now, it's really important that we are able to line you up exactly the way you are on that initial day of CT scan, because that is actually what we're treating. We're treating that scan. So on a daily basis, we will be having you come back in and lining you up perfectly. Now, before we actually start your treatments, we'll have images that we take while you're on the radiation table, and we'll compare those to the images we took on your day of CT planning. And we make sure those line up perfectly. And if they do, we start your treatments. Now, those end up being Monday through Friday, no weekends, no holidays. You're in and out of the department in about a half an hour. The beam is probably only on for about 5 or 7 minutes or so. Now, I'll see you once a week to make sure everything's okay. The side effects from radiation, you won't notice anything the first week. But then as you get into the second and third week of radiation, you will start noticing side effects. And the one systemic side effect you get from radiation is fatigue. Everything else is based on where we're aiming the beam. And I'll get into more details with that with you and your particular site that we're treating.